about 64 seconds, something like that. Good morning and welcome to the June 3rd meeting of the Cumberland County Board of Commissioners. We are happy to have you with us today. We bow for a minute for just a word. Heavenly Father, we come before you at a time when there is just a multiplicity of issues facing us. We pray that you keep us with clear minds and kind hearts and the stamina to do what is absolutely right for the citizens of Cumberland County. We know that without you, we are nothing, and so we depend on you. We thank you and we praise you. Amen.
Amen.
All right. Help me up. Okay. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay. Wait a minute. You got a little chair. Y'all got to help me. Okay. Thank you. I'm going to call on the county manager, Ms. Amy Cannon.
Yes, ma'am. Good morning, Madam Chair and Commissioners. This morning I have the pleasure of introducing Mr. Greg Weber. He is the new Arts Council President and CEO, and I thought this would be a good opportunity for him to come this morning, tell us a little bit about himself and the vision for the Arts Council in our community. Welcome, Mr. Weber. Please come forward.
Thank you. We're glad to have you.
I'm delighted to be here, very delighted to be here. Chairperson, Council, Commissioners, County Manager Cannon, thank you so much for the opportunity to come here so early in my tenure and speak with you. And I'd like to share with you today some of my thoughts about the Arts Council in the community. I've spent 35 years as an arts leader all around the country and working in over 44 different countries around the world. But I'm not just an arts leader. I'm a business leader. I'm a capitalist. Nonprofit is a tax bracket. It is not a way to do business. But as a capitalist, I'm a capitalist who has made his living through helping cities and people and communities strive for and build their arts community. And I do believe that if you want a growing community, then by golly, you'd best be investing in the arts. At the Arts Council, I view the Arts Council as a business-to-business organization. We are a catalyst for a thriving community, and our mission statement states that we support individual creativity, cultural preservation, economic development, and lifelong learning through art. That means that our mission statement instructs us. It tells us as an organization to be innovators in the community, creativity, preservation, economic development, and lifelong learning. I do believe that great communities, like great businesses, require a very smart and educated population. The value of arts as a catalyst for creating this type of a population and this generation has been proven again and again in a multitude of studies, not to mention the importance in the arts in creating a kinder, more generous, and humane society. Therefore, because I do believe in the importance of education, the Arts Council will be focusing much more energies and efforts on our Cumberland County schools, especially our Title I schools, which you're well aware we have over 60 Title I schools inside of our community. Because I believe that arts are so important inside of our schools, then the Arts Council, as our flagship beginning this year, will set a goal of having either an Artist in Schools program or an event in every one of our schools within 3 years, free of charge. We are committed to helping create the next generation of leaders inside of Cumberland County. But also as a B2B company, the success and sustainability of the organizations and the people that we invest in is critically important. And we invest annually over $1.5 million into 31 organizations and individuals and entrepreneurs inside of this area. However, our investment needs to go beyond just supporting them annually. We need to make certain and help them push forward to be successful organizations inside of this community. Therefore, as another item that we'll be beginning this year, we will actively promote all of our organizations outside of Cumberland County. What is most important to me in making certain that we grow is that we create OPM, other people's money coming inside of our community. And by golly, this year we are going to do it, and we are going to do our part at the Arts Council in marketing the great things here in Cumberland County. But also as a B2B company, it means that we have to make certain that our services are open to everyone inside of Cumberland County. So therefore, I'm looking for more partners. I'm looking for people to help. I'm looking for people to participate. And what I'm talking about is I'm looking not just to arts communities downtown, but anyone, schools, festivals, churches, anyone in the community that wants to channel the growth of this county through the arts. I want them to be a partner with me, and I want to help them, by golly. I want to make certain that we strengthen everything inside of the fabric of our community. And for that, I need your help. I'm brand new here. Who else wants this community to grow, and who needs investment and support? I will tell you, they'll find friends at the Arts Council. Now, our commitment also to public art is going to continue. Public art helps to define the values of a community. It not only defines the importance and how we believe that beautifying our environment makes for a better city, but also it empowers us to dream, it empowers our children to dream and believe inside of the community. But our public art program needs to go beyond downtown Fayetteville. So therefore, we're going to be pushing that public art program inside of other parts of the community. Those areas of the community that you want to see it, please call me. I want to hear, I want to work with you. I want to make certain that the entire county gets the benefits that we've been seeing public art in downtown Fayetteville. And lastly, don't miss our signature events this year. I'm not going to give away today what we're going to do, but I certainly don't think small. And I certainly want to make certain that whatever we do, the International Festival, the Dickens Holiday, and the Black History Month, expands what Marge, my wife, and I see inside of the potential and the possibilities inside of this, our new home, Cumberland County. So with that, I'm willing to take any questions or anything from the council, from the commissioners.
We are happy to welcome you officially to the County of Cumberland. Are there any questions or comments?
I have a comment. Sir, just listening to you and what you plan on bringing to the table here in Cumberland County is exciting.
Mm-hmm.
And I, for one, look forward to the board working with you to help you set the goals that you see need to be set here in Cumberland County. It sounds real exciting. It sounds so inclusive, and I, for one, welcome that. Thank you for being on board.
Thank you, Commissioner Evans. I truly, truly believe that for where our funding source is at, that we will be supporting everything that this county believes in. And the only thing right now holding me back is that I'm brand new, which means I need your help. I need your help to know where I should focus. And I'm asking that today, is your help and your support.
Thank you so much for making that correct decision to come to the County of Cumberland. We look forward to working with you. Thank you.
Thank you.
Ms.
We're shaking his hand. I'm sorry.
Oh, I'm sorry. Come around and shake hands.
Well, welcome people. And maybe even a picture of it.
Get ready, John. We're going to take a picture. Good to see you again.
Thank you.
Welcome, Brad.
Thank you, sir.
Thank you. And a friend. Glad to see you here.
Thank you.
sit down till you pull my chair. Oh, come on, honey.
We do too, a lot of
Sit right
we
here.
can do it in our sleep.
1, 2, 3. 1, 2, 3.
Okay, thank you.
I love the way you just embrace it.
He was standing up before you.
Thank you.
He's sort of leaving this one. We started speaking.
Mr. Hurd, how about coming up front? I'd like to introduce everyone to Mr. Glenn Hurd. Welcome. God bless you. Good to see you this morning. It's my pleasure to introduce this fine young man. He began his career with the Cumberland County Sheriff's Office as a deputy, September the 28th, 1998. As we know, it's a full-service law enforcement agency, great reputation. And over his 21-year tenure, Mr. Hurd stayed in operations. He was a school resource officer. He was in the DARE program. He worked at the courthouse. He worked in mental health. He worked in child support facilities. And I guess we would all agree in his capacity, he probably did a little bit of everything. He retired January the 1st, 2019, and Mr. Hurd wants to travel. And I heard some of his destinations a while ago, and keep an eye on this guy. If he goes everywhere he says he's going, he will be a great cultural arts representative upon his return, okay? He's got a lot of ambition. We want to thank you for your service to the Cumberland County Sheriff's Office and the citizens of Cumberland County. Best wishes on your retirement, and congratulations. And this was given to you, turn around here so John can get you. It says right here, in recognition of outstanding service to the citizens of Cumberland County, September 28, 1998 through January the 1st, 2019. From your friends, everyone here in this building, from the Cumberland County Board of Commissioners, May 6, 2019. God bless you.
Thank you.
Enjoy your retirement. If you'd like to say a few words, you go right ahead.
First of all, I'm very humbled by this presentation and just the fact that the Board of Commissioners, out of you all's busy schedule, will take the time to honor me as a retiree from the Cumberland County Sheriff's Office. I came in a little bit early, and I'll say this, I was listening to some of the comments, and everybody was talking about what they were doing yesterday, and I'm thinking to myself, and I made mention of that to this young lady here, that yesterday was Sunday, everybody's supposed to be off, but I guess with you all's work, it's just never done, and you just can't, because it's Sunday, because it's Saturday or a holiday, those things that are important to you as county commissioners just don't cease. So for you to honor me and take the time out of your busy schedule to do this, I'm very appreciative. I thank you so very much, and I'm very appreciative to the Cumberland County Sheriff's Office for putting up with me for as long as they did, and under Sheriff Butler and now Sheriff Wright. I've thoroughly enjoyed myself. 3 of the best decisions I ever made in my life. One was giving my life to Christ. Secondly was joining the United States Army. And third was joining the Cumberland County Sheriff's Office. Thank you so very much.
Thank you. You got to come around and shake hands.
Delete it when it plays on the computer.
Don't let us see that.
Thank you.
Thank you so
Come stand up here.
We'll hold you down.
I know.
Not too
Yeah.
much glare. I hear you.
Then I'll make it to do.
Thank you.
All right, thank you.
Thank you for everything.
Thank you for your dual service.
Get up again.
All right.
Madam Chair, and I don't know how long she's going to be here, but we do have one of our members from the library here, trustee, so I'd like to at least recognize her, and she's here today.
Welcome, welcome. Madam Manager?
Yes, ma'am. Under approval of the agenda, there are no changes, and actually, we can remove item 7, closed session. It was listed only if needed.
Move to approve the agenda with the deletion of number 7.
Need a s- All right, you've heard the motion and second. Those in favor?
Unanimous.
Thank you.
Item number 2 is a presentation, and I'm going to ask our Assistant Manager, Dwayne Holder, to introduce this item.
Good morning, Madam Chair, to the entire board. Happy Monday.
Good morning.
I am very excited to be able to introduce this next item, which is a very innovative and evidence-based model that we are hopeful we will be able to bring to Cumberland County. The Partnership for Children of Cumberland County has been involved in a due diligence process of meeting with stakeholders, and you have the luxury and the pleasure this morning of hearing directly from Ms. Mary Sonnenberg, who's the president of the partnership, and we also have Ms. Megan Squires with Family Connects International, and we also have Ms. Sharon Moyer from the partnership. I'm excited. They came and presented to the Board of Health, and it would be a true complement to services and the service continuum that we currently have for ensuring healthy homes and healthy babies and healthy moms in Cumberland County. So without further ado, I'll hand it over to Ms. Sonnenberg.
Good morning.
Good morning. Thank you for having us this morning. About a year and a half, we went into our allocation process for the partnership, where we look at the activities we're funding and any other needs in the community, particularly targeting birth to 5-year-olds. And one of the things that came out of that allocation was looking at the potential for a home visiting program in Cumberland County for newborns, for every live birth in this county. And we really looked at, could we go ahead and do it? Could we do a pilot? What was the best strategy? And in our investigation and presentation to our allocation committee, we looked at the partnership funding, a 3-year planning cycle with Family Connects International out of Duke, to look at the capacity of this community to bring this home visiting program here. It's a little different. There are a lot of home visiting models out there. This one targets all the newborns in the county, so every child who's born, their family would be offered a home visit. You know, the elephant in the room and the big question is, okay, how much will this cost? And it will probably cost about $3 million a year to do it. That can come from a variety of resources, and we're not at the funding stage right now. It will take everybody coming to the table to figure out how to make it happen. Some of it is billable to Medicaid at this point and potentially insurance. But I thought the best thing to show you is this little video clip that CBS did on it, and then Megan and I will sort of talk a little bit more about what it looks like. But as Dwayne said, we have spent the last year meeting with a variety of community stakeholders, from the medical profession, social services. Looking at this came out of our work on our child abuse prevention plan for the county and focusing on prevention. If we can touch those families with newborn children from day one, or very shortly thereafter and get them into the right resources, or just assure them that everything's great and they're on the right track, then we can have an impact. If we wait till they're 4 years old and get them in NC Pre-K, we've missed 4 years of their life in getting them in the right resources. And so we know that birth to 5 and even prenatal is where we really have to focus on those younger years, and this is a way to do that. So if I can make this work.
With the innovations that are paying off in Durham, North Carolina, all parents are offered a helping hand in the first few months of their children's lives. 30,000 families have welcomed registered nurses into their homes as part of the Family Connects program. Our Dr. Tara Narula shows us how it's working to help lower healthcare costs and raise parent confidence. Tara, good morning. This seems like one of the most brilliant ideas I've ever heard. I love it.
Such a great initiative, public health-wise. The first year of life is crucial to the developing brain, but parental instincts are not always enough to take on the challenges of caring for a newborn. Sometimes it takes a village to support, listen, and embrace the entire family.
Hi, good to see you. Come on in.
Good to see you again.
Okay.
How are you doing?
I'm good. How are you?
Hi. Oh, hi, Jenny.
Nurse Jenny Jensen is delivering some extra care
You can just hold her, and I'm going to give her a little listen.
right to 5-month-old Cora's doorstep.
She's going to stretch you out.
She's tracking pounds and inches along with the parents' stress levels.
We have had our challenges, ups and downs.
Can you tell me more about what was going on?
This past Sunday, I just felt sad.
Before they leave the hospital, new parents like Zawadi and Damon Walker are offered free home checkups.
I think we both had the same fear about being left to our own devices with this whole new life.
The first visit comes a few weeks after birth.
Was she sleeping too much? Also with the breastfeeding, is she getting enough nutrients?
In addition to organizing feeding and sleeping schedules, the nurses address safety conditions in the home, working with the pediatrician if there are health concerns. But some of their most meaningful advice covers work-life balance and personal relationships.
She took time to ask about you
Yes.
and you together.
Yes. She gave us tips, told us not to be afraid to reach out to our support so that we can have some moments for ourselves.
It's a very personal thing to bring somebody into your home. Just about everyone in your life has an opinion about how best to care for that baby. We're able to provide evidence-based information for families that they can trust.
The nurses help parents find daycare, government benefits, even the safest car seat for their baby. Between visits, nurses stay in touch with their families by text and phone,
Just wanted to call and check in and see how your weekend was with baby Harper.
fielding questions that may not surface at the doctor's office.
Pediatricians are wonderful professionals, but they simply cannot have 2 hours to come into your home, and that's what our nurses are able to do.
Duke University's Kenneth Dodge developed Family Connects.
Parents are very anxious. Maybe the system worked when mothers stayed at home full-time, but that's simply not happening very often today.
And the program is paying off. For every dollar spent, it's estimated $3 in healthcare costs are saved. Emergency visits for babies in Family Connects were cut in half.
Parenting is more positive. And then in the long run, we found important outcomes such as lower child abuse rates and lower health care costs for emergency room visits for injuries and illnesses.
Even experienced parents are embracing the help.
Hey, would you like to get a book that I can read to your brother?
3 years ago, Megan Dunphy Daly gave birth to her daughter in Washington, D.C.
Would you like some avocado?
After the birth of son Caden in Durham last May, Megan thought she and husband Jason still had a few things to learn from an expert.
She watched me nurse him and provided advice on that. It was much easier than bundling everybody up and taking my older daughter to the doctors with us.
Hi, baby boy.
If I could have had this with my daughter, I would have been a much more confident first-time parent.
He loves you.
The program's impact is being felt nationwide. 16 communities have sent nurses to be trained in Durham, and 14 more sites are being added soon.
So who's paying for it?
So there is government funding, but also there's funding from the state level, the community level, profit organizations, and nonprofits. So it's a group effort, but a huge public health impact from something that's so simple.
I absolutely love this idea. Now, you pointed out that it lowers healthcare costs and emergency room visits. Explain how that works.
So Dr. Dodge gave a great example, which is, for example, if a mother sees a rash on her child at 2 in the morning, in the past she might have taken them to the emergency room. Now, if she's connected with a grandmother down the street in the program, she can call her up and maybe have her tell her, you know what, that's not so big a deal. You don't have to go to the hospital. Also, they teach families safe practices about not putting your baby on a high up area where they could roll off, making sure they have a crib in the home. So things like that where they avoid injuries and accidents.
Are there any restrictions at all on what families can participate?
There's not, and this was a really important point, is that it applies to families of every socioeconomic background, every demographic background, because as they say, every family has needs.
Yeah.
Every family needs support. And this is something we don't ask for support, but we are evolutionarily, biologically based human beings that need support. That's how we grow.
I took care of my sister growing up, and even when I became a mother, I thought there are so many things that nobody taught me that I didn't know about. Everybody needs help.
Yes, and he also makes the point that, look, we talk about children being the future of our economy, of our society, but they're human beings now. They're part of our community now. Right? And we need to invest in them now, as we would with anybody else.
And they're more demanding than ever at the beginning.
Right now. Just my luck, it comes 16 years too late.
All right. Tara, thanks. And for more on Family Connects and a step-by-step guide for soothing a fussy baby, go to our website, cbsthismorning.com.
There we go. Got it. Very good. Thank you. I think that gives you a broad perspective of what the program is. It is a universal home visiting program, and that was one of the things as we looked at things that we could potentially do that really intrigued us, because no family knows what needs they might have when that baby's born. And so it does target all of the populations that we often serve, but to make sure that every parent gets that home visit in the first little bit. Postpartum depression is screened. Megan can talk a little bit more specifically about the program and answer any questions. But we wanted you to have a briefing on it so you knew that we were looking at this and working with this. We've had lots of conversations with the health department because they touch so many families, as well as the Department of Social Services. They were actually our first two people that we talked with when we did our first visits last summer, starting to get with our community stakeholders. And again, we've been doing lots of community meetings. We'll be doing some more, looking at who would be the right organization to host this program. It is staffed by nurses. So it is very much a model that we want to do to fidelity. So it's important to get the right group so that we can do the funding pieces that we need to do and make it sustainable, so that if we bring it, that it is something that will be a benefit to our community for years to come.
So thanks so much for having me here today. So my name is Megan Squires, and I'm with Family Connects International. My role is an implementation specialist with the program. So basically that means I take the model from Durham, where the evidence base was grown, and I help replicate that in other communities. So Cumberland County, the partnership, came to us last year with interest specifically around the reduction in child maltreatment rates in Durham. Part of the SOAR committee, which is community-wide to reduce child abuse in the community. And so we know from the Family Connects model that in Durham, the Family Connects home visiting program decreased rates of child maltreatment in Durham by 39% within 5 years. So we are looking to see what that looks like longer term, perhaps within 10 years. So I did provide you all some additional handouts that talk more about additional outcomes of the model. As you saw in the video, there are healthcare savings associated with Family Connect. So every dollar spent on the program, $3 are saved by healthcare systems, likely because of the decrease of utilization of emergency care and overnight stays for infants. Blue Cross Blue Shield did give Family Connects $1 million last year to look at implementing the model in rural parts of North Carolina. So we do have, besides Durham, 2 other communities that currently provide Family Connects visits. That includes Guilford County and Forsyth County, and we do have many other communities across the United States that implement. Oregon will provide Family Connects visits statewide beginning in 2020. So, do you have any specific questions right now that I could answer?
We have two. First, I have two lights, Mr. Adams, and then Mr. Keefe, 3 lights.
Okay, great.
Mine just
Then
goes
Mr. Booth.
to Mary, and I guess I'm a big proponent of it. As well, the United Way can be a part of this with the Dolly Parton. I think every book that goes into these kids' hands, it gives us a great opportunity as we go to do this visit to have that filled out to.
Absolutely,
Yes, I mean-
absolutely. When the home visitors go out, there are many programs already in place in this county. I mean, we have Early Head Start that does home visiting. We have some other programs that are doing parent education. It's not to take the place of those, is to make sure parents know about them, and if they need a referral, like to Early Head Start or one of the other programs that's already in place, that they get that referral early. And so Dolly Parton Imagination Library will absolutely be at the front of the line of being, okay, we're here, we're going to go ahead and get you online and sign you right up, because it's really easy. You don't even have to do a paper copy. And they do that in
Okay,
Durham.
thank you.
Yeah. So we absolutely want to maximize. That's why these community meetings have been so important, because we're aligning and finding out what resources are out there. And then there'll be a resource directory that the nurses will go to that will be live and give us actually a better idea of all the resources that are out here in this community.
Mr. Keefe?
Thank you, Madam Chair. This is actually probably more for Megan. As you're going through this process, we all know that Durham has a very robust medical community. How are the health systems? Have they come on board and helped out with this? Are they partnerships in this? And I'm not speaking specifically to Cumberland County, but traditionally as your model comes.
Yep. So happy to speak to Durham and to the initial work that has happened here in Cumberland County. So in Durham, we have agreements with the 2 main health systems, so Duke University and then Duke Regional, which was Durham Regional. And so what happens is we have staff who go to the hospitals and recruit families there when they give birth right before discharge. So we have those relationships there with them. In addition to those big healthcare systems, the medical providers, even the OB-GYNs and the pediatricians, they know about the model. And the OB-GYNs will often tell women before they give birth, hey, someone's gonna come and ask you about if you want a home visit, we recommend it. They're prescribing it. And what happens with the Family Connect model is at 3 weeks, when the nurse does a visit, they're getting this information, they give that back to the provider. So it's this continuum of care that's happening pre-birth, post-birth, and even before the mom gets her postpartum visit at about 6 to 8 weeks. Pediatricians also get information about the infant. So one of the reasons we have nurses do these visits is because of the more intense health screenings they can do that just a social worker is not trained to do. In Cumberland County, we have started having conversations with Cape Fear Valley Medical Center, the nursing administration staff, so they are aware, they're interested in what they can do to support us.
Yeah, and we were having conversations with some of the other care, 4C and all of the other medical, and trying to really make sure we're getting in there. Of course, having conversations with the health department, who already provides a high level of care for a big portion of our community. So it is critical to involve the health system. Otherwise, it's just another program.
Thank you.
And as a follow-up.
Mr. Booth?
Just really quick, Madam Chair. As a follow-up, of course, you understand in Cumberland County, there is a very large military contingent. And I just wanted to make sure we have a lot of young mothers who are there and sometimes by themselves with deployments and stuff. So I would hope that the Fort Bragg contingent is also included.
We've been having conversations with them as well, and there's even some interest at the state level for making sure that that collaboration with the military community is very strong.
Thank you.
Okay. Mr. Booth?
I have just 3 quick things, and I'm not sure who's going to toss them back at me, but is there
statistics or data on about how long the contact, the counseling, the treatment, I don't know what the program's called, that Jeanette's a young mother and she asks for the assistance with her 6-week-old child. Is there like a standard thing where you only see her for 6 months? Or, or do you stay with them until they're 2 years old? I mean, what's the...
Great question.
Yeah, there is a protocol.
So there are so many home visiting models out there that are definitely longer term. Family Connect is truly more of a brief treatment screening model. So the prescription is really 1 to 3 visits. And that initial home visit is about 2 hours long. So it is very long-term. It's very integrative of all issues, not just health, social determinants of health.
Presentation, that it's not just a medical thing to introduce you to your child and how not to drop them and everything, but they also come equipped with other resources that they may not be proper for any of them, or they may be proper for all of them. So that, I think, is very, very crucial. 2, have you made a presentation to Cape Fear Valley, either the administration or the board or something?
We met early on with Mike Migowski at Cape Fear. We've worked with the nursing staff. We have not met with their board yet, or have we?
No.
But we are planning to schedule that.
Yes, Mr. Nagowski's very interested in this, obviously. Anything to reduce the emergency room visits, and that wait time is essential for him. We have been meeting with some of his staff on this as well. We are working to coordinate an actual visit with some of his staff up to Durham to see the plan in action. And then we will be meeting with the hospital foundation soon as well. And then we'll be trying to get on the board's agenda as well.
He's a family guy. He's a huge, big-hearted guy.
Absolutely.
But when I saw that thing up there that said every dollar put in will save $3 down the road, or in emergency room visits, or prenatal postnatal issues and stuff, then I know that made him even get a warmer spot in his heart.
Absolutely.
It's already a huge warm heart, but if you let him save $2 on it,
right. He likened this to a program that they currently have for stroke victims, that once they're released from the hospital, an EMT follows up with a home visit, because that reduces their reoccurrence to come back to the ER. So he understands how a home visiting model can work. And on a side note, his wife, Mrs. Nagowski, has been very involved with our organization and is also getting involved with this.
Then you're already in.
Right?
Right? Also, we just launched at 6:02 a.m. on 5/2, May 2nd or something, Epic, which is an unbelievable data system.
Right.
So
yes.
this could be, cross channels. With the information you give back, their doctors would then all have access to it instantly.
Yeah,
I think you're at the right time, right place, right.
We think so too.
We'll just stay out of your way.
I hate to cut off excitement, but and it was that way at the health department meeting also. And I know you're going to fold in some of the programs that Dwayne already has initiated. I've been receiving comments about the assistance to newborns. We look forward to having further updates. All right.
We'll be back.
And further contact. Thank you so much for joining us.
Thank you for your time this morning.
We appreciate it.
Madam Chairman, they also have a big summit coming up Saturday out at Fayetteville State.
We do.
That's exciting. That's coming up for our early educators, the Learning Center out at Shaw Auditorium on Saturday. So I just put a plug in for that.
That's right. We do have Michael Bonner coming to present to a number of early child providers. I think we're still taking registrations, and it's our annual event that we have for early care and education. But Michael Bonner is a elementary school teacher who has shifted how he works in his classroom and has had some tremendous impact on children, and is on the speaking road right now trying to share that information. So we're bridging that birth to 5 with our K-12 system, which is absolutely what we have to do. Doesn't stop when they turn around.
Thank you so much for joining us today.
Thank you.
Thank you. Appreciate it. Madam Ms.
Yes, ma'am.
Cannon?
Yes, ma'am. The next item is item number 3, our consent agenda.
All right, are there any items to be pulled from the consent agenda? If not, I'll,
Move to accept the consent agenda.
Second.
all right, thank you. We have motion and second. Those in favor?
Unanimous.
Thank you.
Item number 4 is designation of voting delegate and alternate voting delegate to the 84th NACO Annual Conference.
All right, I'd like to nominate Vice Chair Faircloth, please.
You want to do it, Marshall? You want to do it? Yeah. Okay, second that.
And who's the?
Mr. Evans, I would nominate as the alternate.
You want to do that? Does he know? You want to do that?
He
Okay.
ain't got a
Yes.
choice.
Doesn't have any choice.
Don't have a choice.
Okay. So we have Mr. Evans and Mr. Faircloth. We'll submit those names.
Item number 5
Thank
is
you.
our nominations.
For the Nursing Home Advisory Board,
Madam Chair, I would nominate Keith Howard. He's completed his first term. He's eligible for reappointment.
thank you. Are there others? If not, we'll go to the Alliance Health Board of Directors.
Madam Chair, I would.
Oh, I'm
I
sorry.
just have a quick,
Mr.
I
Booth.
see, I like where you're going with this. Have we contacted, it looks like we all have, everybody's eligible. Does everybody
Yeah.
still want to do it on all of them?
Right.
Okay, all right, that's what,
Yes.
all right.
Okay.
Before, I didn't want to.
Well, Mr. Holder, I think, said yes when I asked him the other day.
Uh-huh.
Oh, we didn't need to ask. him.
Mr. Alliance Board,
Madam Chair, Dwayne Holder, he completed his first term. He was eligible for reappointment. And I would
thank
nominate
you.
him.
Sorry, man. Sorry.
Thank you, Mr. Holder. Item C, 5.
Madam Chair, there was Winton McHenry, who completed his first term, Robert Davis, Stacy Long, Marva, Lucas Moore, and Nathan Galbert, and I would nominate them. They're all eligible for reappointment.
Thank you. Item D,
Um,
FACBB.
There was Sharon Lee, who is eligible for reappointment. I would nominate her for that.
And FTCC,
Dr. Linwood Powell just completed his first term. He's eligible for reappointment. Spoke with him, and he would like to be reappointed to that board. So I would nominate Linwood Powell.
thank you.
Item number 6 are the appointments.
Mr. Fairclough,
Thank you, Madam Chair. We have an equal number of nominees for those positions that are available, and at this time, I would move that we appoint to the Cumberland County Home and Community Block Care Grant Committee Joanne Yoakley for the older consumer position, Kevin Walker for the Aging Services Provider position. For the ABC Board, we have 2 vacancies. The nominees are Francis Jackson, who's eligible for reappointment, Alex Warner, who is available for reappointment, eligible for reappointment, excuse me. And for Cumberland County Workforce Development, the 1 vacancy, the nominee is Dr. Mark Sorrells, the representative of educational training, and this is a new appointment.
I
right.
second that.
Let's vote on the appointments. Equal number. Those in favor?
Unanimous.
Thank you.
Thank you.
Move to adjourn.
Second?
Those in favor?
Unanimous.
Thank you so much. Guys, can we huddle for a second?
Give her a chance to say.
I will see you all.
What's that?
Yeah,
Five dinner.
We will be having lasagna, salad, and rolls, and always around time.
I second. Yeah, that's how I could.